Hi, everyone, and welcome to the Community Engagement Series. My name is Priscilla Medeiros. I'm the Knowledge Mobilization and Community Engagement Specialist at the Edwin S.H. Leong Center for Healthy Children, as well as your moderator for the series. I'm incredibly excited to introduce our speakers for today's session. We're joined by Dr. Lisa Hawke, who's a staff scientist at the Center for Addiction and Mental Health. Her research platform focuses on the science and practice of the engagement of people with lived experience and caregivers in mental health and substance use research, alongside research on issues that are urgent public health priorities. We're also joined by Claudia Sendanyoye, who's a research partner on projects related to early psychosis care and engagement accessibility at the Center for Addiction and Mental Health. She holds a Bachelor of Health Sciences from Carleton University, and both of them are joining us today to deliver an incredible presentation, which highlights a meta research platform on lived experience and caregiver engagement, sharing key questions and solutions to improve engagement in mental health and substance use research. So welcome, Lisa and Claudia, for joining us today, and I will now pass it off to both of you for your presentation.
Thanks, Priscilla. We're going to share a screen and walk through some slides. Give me a second here. Are you seeing my slides okay? Yeah?
Yes.
Okay, so thanks for joining us today. We're going to be talking about lived experience and caregiver engagement in mental health and substance use health research, a research study series, and I'm joined with my colleague Claudia here, who's going to walk you through a part that she's been involved in. But I want to recognize a wide variety of team members. There's been a whole crew around this. We have not done this alone. So a big shout out to all of those who have been behind us all along the way. A couple disclosures. I'm funded by CIHR, by CAMH, and the University of Toronto. I don't have any other conflicts of interest. Claudia?
Yep. And for myself, so I was a former employee of CIHR. Currently no relationship between CIHR's work and past or current work at CAMH, and there's no other conflict of interest I have to disclose.
Okay, so our agenda today, we're going to talk a little bit, just for a second, about what is lived experience engagement. We're going to look at 2 scoping reviews of the literature we did to understand the impact of engagement and some evidence gaps. We're going to look at some best practice guidelines that we co-developed. Then we'll walk through a series of 4 qualitative descriptive studies unpacking different aspects of engagement, including communication, power dynamics, untapped potential, and reporting on engagement. I have a few reflections, a few group reflections for you. I'm going to show you those first so that you can think about them along the way, and that might help stimulate our dialogue at the end of the presentation. So as you're hearing us present, I ask you to think about how you might engage people with lived experience in your projects. What other questions should we be asking about caregiver engagement and about child and youth engagement? I understand this is Sick Kids, you've got a good interest in caregiver and youth and family engagement. So let's try to dig into that a little bit more. And what makes it harder to engage, and what are some mitigating strategies? Finding those key points that are really difficult, that's where we find the mitigating strategies and we help improve the work we're doing. So those are a few things to keep in mind as we go through, and we'll have time to discuss them afterwards. So what is lived experience engagement? There is a growing movement towards a paradigm of research where, including in mental health and substance use research, but in physical health research as well, where what we used to call patients and subjects are now our colleagues. They can be advisors, they can be collaborators, they can be co-researchers. They might serve on research steering committees or advisory groups or working groups, various forms of group. And in mental health and substance use health, we talk about people with lived and living experience and caregivers, which we've recently revised our acronym to be PLEC-C, which has the benefit of being pronounceable. So we're going to be talking about PLEC-C through the presentation. PLEC-C can make a wide variety of contributions to research. At the early stages of the research process, they can be involved in priority setting and setting research questions and designing research to make sure we get it right from the get-go. During project planning and operations, they're really good at advising on participant-facing tools and co-designing participant-facing tools to make them more relevant and accessible to our participants. They can support recruitment strategies, research procedures, troubleshooting. We've had them train RAs before in how to work effectively with the participants. We've worked on recruitment strategies and retention strategies, all kinds of things like that. At the end of the project, they can be involved in interpreting the findings, co-analyzing data, doing lay knowledge translation, and as well as academic knowledge translation. We have co-authorship roles, co-presentation roles. Basically, they can be involved all the way through the research process. So we did a couple of scoping reviews on engagement. One was by my PhD student, Yasmin, Natasha Y. Sheehan, Yasmin. So big shout out to her. And then I did a piggyback scoping review on top of that. And we wanted to understand two things. What is the impact of lived experience engagement in research? And what are the research evidence and practice gaps in the science of lived experience and caregiver engagement? So as far as the impacts go, as far as the method goes, we searched for articles on mental health and substance use describing impacts in Medline, CINAHL, and PsycInfo. We found 2,879 unique records, and we went through the scoping review screening process to slim that down to 61 articles in the past 10 years on impacts. And then we only looked at the past 5 years for evidence gaps. We wanted that one nice and recent. So 49 articles for that. So here are the impacts. There are quite a few impacts you'll see. This is a bit of a tough one to read, but I'll highlight some of the highlights for you. We find that engagement has impacts on the research quality, things like improved rigor and validity, improved data collection and methods, more reflexivity among the research team, more depth and richness of the data. We find improvements in research components, so things like the ethics process, the recruitment process, forming a wide range of ideas and outcomes, contributing in general to the study success. We find improvements in the research environment. It adds diversity to research settings. It shifts the power dynamics. It destigmatizes research, which is really important in the world of stigma in mental health and substance use. We see positive impacts for our study participants. We find that it adds value for participants. It increases retention of participants in longitudinal studies, and it helps make sure the research is accessible and acceptable to the participants. We find positive impacts on the researchers, new perspectives, changes their research practice. It's a rewarding experience. It has strengthened their commitment to engagement, and they generally find lived experience to be an irreplaceable expertise. We also found positive impacts on the people with lived experience who are engaged in this work. They talked about positive impacts on their recovery, more confidence, transforming their own narrative, building knowledge and skills, helping them with personal and professional growth. So lots of benefits all the way around when people with lived experience are engaged in the research process. So we took another run at this to understand what are the research evidence and practice gaps. I wanted to look at this literature that was found to understand what don't we know about the science of lived experience engagement. What do we need to learn more about? And we found that there's a gap around conceptualizing engagement, which is about defining exactly what aplexy is, who aplexy is, standardizing technology, and understanding that continuum between lived and learned expertise. So what about when you have a person with lived experience who also has a PhD in a related field? Does that count as lived experience engagement? I've peer-reviewed grant applications where our lived experience partner has an MD. Does that count? How does that count? How do these intersectionalities come into play? Another gap was developing resources. Folks wanted best practice guidelines and concrete tools and resources to support engagement. Evaluating engagement is a big gap. We need to understand ways to evaluate the impact on research, the impact on plexi, the impact on researchers, and we need to evaluate it with plexi involved all the way through. And diversity. We know that there's a lack of diversity in engagement settings. we need to evaluate the engagement on diverse samples and not just on certain people who come through the door first. In terms of implementation gaps, we found broader institutional gaps as well as gaps in day-to-day practice. So things like sufficient and flexible funding, institutional support, ethics board support for engagement. Sometimes we have challenges getting these things through ethics boards who don't agree or don't understand about people with lived experience as colleagues. We need support from our funders and communities. We need to do clear and early planning of the engagement process, not just jump in without a plan. We need to invest time in building relationships and rapport because that invested time helps good engagement happen. We need training in mentorship, diversity, and flexi in leadership. So these are the gaps that we found in the literature, and this has kind of been my starting point for everything I've been doing on my research platform. Whenever I have downtime, I go back to this review, identify what is the next gap that we need to address. And I've been walking down the list and addressing evidence and practice gaps in my research. For each project I present, I'm going to tell you about how people with lived experience were engaged in that project. In the scoping review process, we had a lived experience research assistant at the article selection and data extraction process, as well as at the co-authorship, along with an engagement coordinator with lived experience. And we took the findings to an advisory group for a consultation, and they identified some additional analyses, and we dove back into the documents to do some additional analyses based on that discussion. So there was engagement even at the scoping review level. Here are the references. You can always shoot me an email. I'm always happy to send you anything. I know these are flashing fairly quickly, but email me at any time if you want these references. The next project I'm going to talk about is best practice guidelines. So we co-designed some best practice guidelines for the engagement of people with lived experience and caregivers in mental health and substance use health research. And we did this using a modified Delphi consensus study. So a series of surveys that aim to come to a consensus on an issue. Shout out to CIHR and SPORE who funded this and to the team I had around me. We recruited 61 people, which included 35 people with lived experience, including caregivers. I think 15 of them were caregivers, as well as 26 researchers. They came from psychiatry, psychology, social work, public health, nursing, and other disciplines. They came from Ontario and a few other provinces. They were age 16 to older adults. There was a majority of women, which is what we often see in engagement spaces, but we did our best to maximize diversity. So it was a 3-round modified Delphi survey aiming for consensus, modified because we build our initial items based on the literature and our experience. So we built 56 initial items describing best practices in engagement based on the literature, and our lived experience working group worked together on those. And through the 3 rounds of Delphi, we reduced them to 44 final items. Folks rated all of the items on a 7-point Likert scale for importance and clarity, where consensus was defined as 70% or more rating at very important or essential. And that's how we came down to 44 final items that were considered very important or essential to guide lived experience engagement in the sector. I'm not going to present all 44 because that's a lot. Oh, sorry, before that, I'm going to show you a video. This is a video we designed with our lived experience group to describe the Delphi process to people with lived experience so that they could understand it in an accessible manner and follow along with the process. So let's listen to the video.
Welcome to our survey. My name is Bora. I'm a research staff and I'll be guiding you through our process today. With your help, we'll be developing guidelines for the engagement of people with lived experience in mental health and substance use research. Let's start with a description of the study. We are gathering opinions from experts like you to reach a consensus. Think of it as teamwork without the group meetings. We're using questionnaires instead. Now, let's discuss how our rating system works. Our survey items are made up of recommendations. You'll be asked to rate the importance and clarity of each one. If a recommendation is not at all important or clear, you give it a 1. If it is a bit important or clear, you give it a 2. And so on, up to 7 for essential or completely clear recommendations. Each recommendation also has a comment box where you can share any additional thoughts. We'll use your feedback to refine the recommendations and keep only the ones that participants agree are important and clear. Now, let's dive into our survey platform. This survey has navigation buttons at the bottom of each page: Next, Previous, and Submit. Click the Next button to move forward. Use the Previous button to move back. Once you've rated all the recommendations, click the Submit button. If you run into any problems or have any questions, contact me, Wura. I'm here to help. Great news! You are now ready to begin the survey. Thank you for taking the time and putting in the effort to share your insights with us.
So that's how we went about making a research methodology accessible to folks with lived experience who might not have experience, who probably never heard of a Delphi before. So we broke that down to make it a really accessible survey for folks with lived experience. And it was very well received. We got good comments on our video. I'm not going to walk you through all 44 best practice guidelines. I'm going to highlight a few of the highlights so that you can get a sense of them. Reach out at any time if you want to see more. We had a 5-category content map. So we had 6 items under initial reflections and underlying values. These are those overarching reflections rather than concrete guidelines, just to get us started. So things like consider why you want to engage people with lived experience and how their expertise can be included in your project. If you're only engaging for the sake of the grant application, it's important to acknowledge that so that you understand why you're doing this and maybe try to move forward into actually recognizing the value and appreciating it. Acknowledge that people with lived experience are experts who can inform research, make the research more relevant, and improve its quality. It's really important to be starting from this standpoint where we do recognize the value and we truly authentically want the people in the room with us. In a section on planning to engage, we had 12 items. This included items such as plan to start engaging people with lived experience as early as possible in the research project. This is a big sticking point. Folks sometimes don't engage until it's funded and it's been through ethics and very little can change, which is really a problem. We want engagement straight up front. It's tricky when you don't have the funding yet, but if you can find the funding to do it right at the priority setting stage, that's optimal. Certainly before your ethics is approved, because then you can't change much and there isn't much room for authentic engagement. Plan to be flexible in the project and make changes to it based on lived experience feedback. That's really important. Sometimes researchers might walk in and really just want their methodologies validated. No, we need to be really legitimately willing to make changes as we go along. We had a content category called onboarding people with lived experience with 7 items. This is a really critical stage for getting everything started properly. An item said engage more than one person with lived experience on each project to ensure that diverse experiences are heard and to provide opportunities for them to support each other. This one was particularly important among young people in our sample. We did do some equity analyses to make sure we weren't missing something that was really important to certain groups. So this was important to young people to make sure they have other people to support them through the process. Take the time to establish friendly rapport and to build relationships with people with lived experience. As I mentioned, building rapport is an investment in the project because if people feel good in the room together, they're going to be more likely to share their experience. We have a large section on working with people with lived experience, 14 items. A couple examples are create agendas and presentations that are clear, accessible, visual, jargon-free, and stigma-free. These are all really important. We've been working as a team on creating things that are more accessible. That's a growing point for me. Jargon is something we always have to pay attention to. There's so much jargon in this field, so we have to break that down. And stigma, there's so much stigma in mental health and substance use. We always have to be alert and learn from our lived experience folks about what is perceived as stigmatizing and how to avoid that and how to make them more acceptable. And lastly, ensuring that people with lived experience have the time and opportunities to contribute in ways that are meaningful for them. So making sure we talk to them about what is meaningful to them and give them opportunities that work. The last section was on evaluating and reporting on engagement. So make a plan to evaluating the engagement process and report on it. So we might want to evaluate lived experiences, their experience, the impact on engagement on the project. And we want to determine the extent to which their contributions make them eligible for manuscript co-authorship, invite them to co-author the manuscript if appropriate, and support them in this role. If they've been contributing all the way through the project, then they may very well merit the role of co-authorship, and that can be a very meaningful role for some people in this role, and we can support them in co-authoring appropriately. So the lived experience engagement on this project, we had 13 meetings from design to reporting. They co-developed those initial items. They edited the study flyers. They advised on the content and the design of those videos. We had a video for each round, and that was much of their doing. They met after each Delphi round to review the results and to reword the recommendations. This was the working group that did the rewording and the working of those recommendations. They reported on the advisory experience, and they co-authored both the manuscript and the best practice guidelines document. Here's the reference. Feel free to reach out if you want it, or you can find it here. Check out the QR codes. Here's the guidelines in English, the guidelines that we translated to French, and the scientific manuscript reporting on the results. We did disseminate them through a manuscript in open access format. We've got them hosted on a CAMH landing page that anyone can find through Google. We disseminated to all of the provincial SPORs, Strategy for Patient-Oriented Research, and it was shared by a number of SPORs, including the Quebec SPOR and the Yukon SPOR and the Alberta SPOR. There were local and national presentations, and the Lancet Psychiatry Lived Experience Commission shared them, which I was pretty excited about. Now we're going to move on to a qualitative study series that we've been conducting to understand, to unpack some of those aspects that were identified. Remember that scoping review of evidence and practice gaps. So we dug into that and identified some of those key gaps, and we started unpacking them through a qualitative study series. And I'm going to hand it over to Claudia to talk about this.
Yeah, thanks, Lisa. So as Lisa mentioned, so this qualitative descriptive study aimed to understand the experiences and preferences of plexi engaged in mental health and substance use health research in terms of three key areas. So this included communication styles and strategies, analyzing power dynamics and engagement research, and understanding relationships and rapport building in this space. Lisa, do you mind changing the slide? The next slide, please. Perfect, there we go. And so the methods that we used for this was we conducted 4 focus group discussions with 18 participants, and we audio recorded, transcribed, and conducted a thematic analysis. Next slide, please. And so some of the key demographic characteristics from this study that I'd like to highlight are 33% of participants were youth under 30, 22% identified as transgender and or non-binary, 11% were caregivers, 33% had a dual role as both a person with lived and living experience and a caregiver, and 39% were involved in child and youth engagement research. And the first paper that came out of this study was on the communication styles and strategies, and the 4 key themes that that arose from our analysis were number 1, communicate in trusting and respectful ways. 2, to use accessible communication styles, so providing various ways of communicating. 3, to employ effective communication approaches before, during, and after meetings. And 4, to use technology effectively to support engagement. So in terms of communicating in trusting and respectful ways, so this included active listening, so being fully present and seeking to understand before responding. Number two, to have open and honest communication. And three, facilitating a safe space for authentic contributions. So creating an environment where people feel free to share their ideas, any dissenting views, and lived experiences. And so a quote that one of our participants gave to illustrate this included, I think it's important to have the active listening, the sort of awareness and sensitivity to not transgress certain boundaries, and also the openness to actually see things or try your best to see things from other people's perspectives. Our second theme on accessible communication styles. So this included using plain language, being mindful of nonverbal communication and how other people may present nonverbally, and to adapt communication style to individual preferences. Our quote that we pulled to illustrate this states, I think nonverbal communication is often very much overlooked, because if you don't look too happy or engaged, like talking, then everyone else in the group might hesitate to say something. And our third theme, so to employ effective communication approaches throughout, so before, during, and after meetings. So this involved providing regular reminders, having a clear project plan, and offering post-meeting debriefs. And our quote here says, having it written out in either an email or notes section, like a string of everything that was talked about, so it's easier for people to reference the information. I think it's really important, because if we all have the conversation and walk away, it isn't as good for verbal information. And our final theme here for communication was on the using technology effectively to support engagement. And so participants talked about trying to use commonly known software packages, so like Zoom or Teams, to pay attention to privacy considerations and accessibility needs and supports, and providing in-person engagement options. So one participant said, I've noticed a few times, like in Microsoft Teams, I guess people just call you without a heads up or anything, and they just expect you to pick up just because you're online. But I think that's just like courtesy, just sending a quick message saying, hi, can I call, or something. And so that's the reference for our paper, which was submitted. Our manuscript was submitted. And our second paper was on balancing power dynamics. So the themes that we pulled from here included leadership, knowledge, and expertise generate power. Power dynamics should be acknowledged and balanced to improve the research quality, and power can be shared through authentic engagement practices. So academic knowledge and expertise create power imbalances. So Plexi have expertise and should share the power. And lastly, researchers lead the team by supporting the structure of meeting and guiding the project. And so one of the quotes that demonstrates this is, so one participant speaking about having a researcher as the lead, is that you need someone to enter the team and say, okay, thank you all for your opinions. Here's where we're going to go. Our second theme, so power dynamics should be acknowledged and balanced to improve research quality. So to balance power, researchers should directly acknowledge this and address the dynamics on the team. And as I mentioned, it helps improve research quality. So the two quotes that illustrate this are, people will see those in lab coats holding more authority and power, and I think this needs to be identified and just brought to the forefront so people feel like this is an open forum. And our second quote here is, well, it's valuing what people have to say, really valuing it because it makes your research better. And our third theme, so it's about giving Plexi opportunities to contribute meaningfully. ensuring good communication practices, as we talked about a little before, building mutually supportive research environments, and truly respecting and valuing the contributions of Plexi. And so one participant stated, when it comes to power, I feel like I've had very pleasant experiences with feeling like an equal among everyone with the team. And that's also done like being able to be labeled a co-researcher or being able to have the opportunity to contribute to a paper and have my name attached to it. And here's the reference for our manuscript that was submitted. Okay, and so now I'm going to talk a little bit about our other qualitative descriptive study looking at the untapped potential of engaging people, so Plexi, in substance use and mental health research. So our aim was to look at what is currently missing in terms of the contributions that Plexi make to research project. And to do so, we conducted 5 focus groups with 28 Plexi participants. And we conducted 12 individual interviews with researchers as well. And these were all recorded, transcribed, and analyzing using thematic analysis. So the themes that we pulled from the research included, various untapped areas included the project initiation stage, research operations, and end of grant knowledge translation. And we'll get into the respective categories drawn out from these themes on the next slides. So in terms of project initiation, so to understand what's missing, in terms of the contributions from Plexi. So this involved their involvement in establishing research questions and priorities, understanding and contributing to the grant application, and understanding and contributing to the RAB process. So the quotes we received from participants to illustrate this include, I was not there at the beginning stage of the brainstorming. I could only really point out some additional ways that we could use the data that we're trying to compile. And the second quote was, am I being asked to be a part of this because they really want my perspective, or are they just because they need the grant to be approved? And so what's missing in terms of Plexi's contributions during the research operations really was focused on the data analysis piece and recruitment process. So one participant said, my impact looked a little bit different because it was kind of like a confirmation. It was like, does this resonate with your experience that you've had? So most of my feedback was yes or no. And lastly, the end of grant knowledge translation. So there was a gap in Plexi's contributions, sometimes in conference presentations and webinars, manuscript writing, and co-authorship. And so one participant said, so I did engage in the knowledge translation reporting process for several of my projects. I think in terms of the changes that were made, they were mostly superficial in terms of the overall design changes to the presentation versus real structural changes in terms of the dissemination of information that was gathered. And so some implications. So firstly, Plexi, they are ready and willing to contribute to a broad range of aspects in the research process. And early and continuous engagement are best practice, but there is limited engagement in some of the stages described earlier. And so the recommendations that we gathered were to first find out what Plexi wants to contribute to and what their skills and goals are. Don't assume that your members of your engagement practice can't do something, but instead ask and find ways to provide opportunities of interest. And so the lived engagement for this piece of the research, so we had our working group was involved from the design to the paper writing. And we had 2 biweekly meetings and asynchronous 2 biweekly meetings for 2 hours and asynchronous paper writing. We contributed to the study flyer, the interview guides, the demographic form. We recruited the recruitment approach, the code book development, theme and sub-theme structure, and the quote selection. And then we were also offered the opportunity to receive co-authorship and co-present our findings. And yeah, so now I will just pass it back to Lisa to walk you through our other qualitative study and guidance document. Thank you.
Thanks, Claudia. So I'm going to walk you through one more qualitative study. This one was done by Natasha Sheekin, my PhD student, so a big shout out to her. But I wanted to give it a little bit of airtime today because I feel like it's an important one. She worked on co-authoring and reporting on lived experience in mental health and substance use research. So she provided a guidance document on how to report on engagement. We've done all this work to do engagement, and it's not always clear how to report on this when we're writing up our manuscripts. So the research question was, what do Plexi partners and researchers perceive as valuable components to report on regarding engagement in mental health or substance use research? She did individual interviews with 13 Plexi and 12 researchers. They were recorded, transcribed, and analyzed using template analysis, and folks ranged in age from 24 to 63. And here is her guidance document that she developed. So when we're reporting in an article on engagement, first we ask who was involved, who were the Plexi engaged, are there any descriptive factors that are relevant to the research question? And if you're going to describe folks with lived experience, consider also describing the researchers. Are you going to describe what their age was, what their gender was, what their ethnicity was? Well, you should probably do that for the researchers as well to be equitable. What were the activities, roles, and responsibilities of your Plexi? What were their specific activities? What were their roles and responsibilities? Some extra reflection questions. How did you go about the engagement process? What did it look like? What were your decision-making processes and feedback loops? Did you compensate your partners? When did engagement occur? So what was the timeline? At what stages were they engaged? And finally, what was the impact? How did they influence the project? What was the impact on the Plexi? What was the impact on researchers? And we piloted this guidance document. We've done this in the studies that Claudia was talking about. We started going through it with our Plexi working group to understand how engagement influenced them. And it felt like a pretty solid reflexive process so that we could report on engagement in a way that is clear to the reader and the academic reader at the end of the day and was authentic to the experience that we had together. There's the reference. As always, reach out to me for any feedback. The Plexi working group was on this project as well, which is really great when it was a doctoral dissertation. It's hard to do engagement in a doctoral dissertation, but she had a working group. They reviewed and edited the recruitment plan, contributed to the interview guide and the document drafts, brainstormed ideas. They pilot tested the interview guide. They reflected on the analyses and they guided the direction of the paper, and they were co-authors of the guideline and the manuscript. I wanted to give a word about accessibility because this is something that I've been consistently thinking about and trying to improve. And I think with each project, we get a little bit better. So for the working group partners, we are summarizing meeting notes before each meeting so that they can have a snapshot. This was something they asked for to make it more accessible, so we send them that snapshot. We've provided tech support and orientation to WebEx, which is our institutional platform. This week, we are switching to Zoom, which was hard for me, and I resisted it because my institution supports WebEx. But they asked for Zoom, so we're moving to Zoom, and we're going to give that a try. They've had options to participate, phone, chat, email. For research participants, we developed that instructional video. We've learned that we need to do a plain text downloadable script. We provided the option to complete in person, even for virtual studies. We had a couple folks come on site and we lent them a laptop so that they could access the study. We provide the tech support, the orientation to WebEx. We have made our flyer screen reader accessible and provided high contrast, and we have captions available. So we're continuing to grow on this. Future additions, I've budgeted in a grant that's under review for dependent care and travel expenses for those few people who want to come in. It's been highlighted that we should look at ASL options and live captioning options. I need to look into this institutionally because this sounds like something we're going to need a legal agreement for, and we have a very bogged down legal department, so I'm not sure if we're going to be able to do that, unfortunately, but I'm going to look into it and see if there's anything we can do. A quick look at current and future projects in this line. So we have a qualitative study series under peer review to extend the series we just presented to you. These are some questions that come from the scoping review as well as from our Plexi working group. We want to explore the potential benefits and harms of engaging. This question comes from the working group. We want to understand how Plexi engagement is conceptualized. This comes from the scoping review. We want to improve researcher readiness to conduct engagement. This comes from the working group. We want to understand how it's similar or different in mental health versus physical health research. And we want to understand the difference between personal lived experience and caregiver experience, which is something that we run up against in practice. We have a psychometric development project series in progress. So where we have a funded study with a photo voice study in completion, followed by a psychometric validation study that's been funded to understand the impact of lived experience engagement on the people engaged. And we have a qualitative study that we finished and a psychometric study that we're just starting and we're looking for funding on to understand the impact of engagement on the research itself. Shout out to anybody who's doing engagement in mental health and substance use. We're currently recruiting for folks to fill out a survey about the tools and resources that are needed to support engagement. Please do reach out to me or to our engagement email address. We would love to hear your feedback on what kind of tools and resources are needed to support better engagement. And we're back to those group reflection questions. So based on all of that, how do you think you might engage people with lived experience in your projects? What other questions should we be asking about caregiver engagement or about child and youth engagement? What makes it hard to engage? What are some mitigating strategies? I'll turn it over to you for questions and some discussion.
Well, I want to thank both of you, Lisa and Claudia, for such a great presentation. It's such a breadth of work that you're involved with at CAMH, and I certainly, through your presentation today, have a lot of reading that I need to catch up on by the sounds of it, which I'm very much looking forward to. At this time, I'd like to open it up to see if anyone has questions for our speakers today. Please feel free to raise your virtual hands. As well, you're welcome to add your questions to the chat for our speakers, and I'll make sure to bring them to their attention. I also wanted to flag to those on the call, I will be following up at the end of this event with an email and post evaluation. Embedded within the email will be the recording as well as some additional resources from the speakers today. I noticed that there's a comment whether or not links can be shared in the chat. Claudia and Lisa, I'm not sure if you have anything at the ready related to your work that you could populate there, but all to say that we certainly will be sharing a host of information post-event with you to kind of capture what was discussed, including the PowerPoint slide deck.
I'm not sure if I have any links right here. I can throw our best practice guidelines article in the chat. That's open access. Otherwise, I'll have to hunt through this for other links. Okay. A lot of it's not published yet.
Perfect. Perhaps while folks on the call are collecting their thoughts in relation to the work that they may be involved with, I could pose a question just to get us started. And it's one in our kind of preparatory meetings we had chatted a little bit about. And it's to either one of you, of course. If you can explain or dive a little bit deeper into the uniqueness about engaging youth compared to engaging caregivers in research. There are certainly nuances between both, and I can see from those on the call today, they are working within those two respective groups. Not sure how many of them are working across the life course, but I'd love to hear your thoughts a little bit more about that uniqueness piece.
Yeah, so I used to work in youth, now mostly an adult, but I used to focus on youth, and there are some differences. You need to think about developmental considerations. So you've got younger folks, you've got often folks without the university education. They might not be as used to dealing with large documents. So we do a lot more activities instead of talking heads, if you will. Different activities to help them get their point across and share creatively. definitely a lot of use of the chat. They seem to be these days not so much liking to come on camera and speak out loud. They'll use the chat a lot. We need to think about, often we want to engage youth and caregivers in these youth projects, but we have to divide them up and engage youth separately from caregivers, because there's a power dynamic piece there. The caregivers hold more power, and they can very easily, without intending to, but accidentally overpower the youth and take on that role so that the youth don't get as much opportunity to share. So the youth want and need a safe space that is for them, that's a creative, safe space to share their opinions separately from the caregiver voice. There are guidelines on youth engagement. There's training on youth engagement. All of that's available, so feel free to reach out if you're interested in more of that.
Absolutely. I see we have a hand raised. Mary, would you like to unmute yourself?
Hi, thank you very much. This is amazing. I've worked on a few things with Lisa, and okay. So my question is, and it's really quite broad, in terms of, I don't want to say obstacles, but things that tend to define how engagement can be can be really executed from a structural perspective. Because it's one thing, when you're kind of managing the whole environment, and when you've got an organization with, a lot of totally understandable. I come from that background, from compliance, and so but how is that? And those challenges, which I'm sure there are, do you feel that there's any kind of a path towards dealing with that, or is it still too soon to say? And obviously, whatever is applicable to CAMH.
Yeah, there are institutional barriers. Hi, Mary Rose, by the way, we work together a lot. There are definitely institutional barriers along the way. We kind of attack them one at a time and see where we're making progress and pull back where we're not making progress, and it is what it is. We've made good progress at CAMH, though. We have a stronger than average institutional infrastructure and acceptance of engagement. We have an ethics board that understands engagement and is very willing to talk through any challenges with you. We have scientific leadership of engagement at CAMH. We have it embedded in our strategic plan, so we can always go back to that and explain why it's important and remind people that it is important. That doesn't mean we don't end up with challenges. Our finance department isn't the most effective in the entire world. It takes a while to get funding out to advisors. It's a bit of a slow and clunky process. There are ethical rules in place where, if we want to follow the Tri-Council policy statement in terms of the privacy and protection of confidential research information, we can't give it to the advisors, so they can't have full raw data in their hands. That causes some problems, but it's an ethical consideration. So we take it one thing at a time and try to plug away at improving the infrastructure, and we've made great progress, but we're not all the way there yet.
Thanks, Lisa.
Yeah, and
it's slow.
Yeah.
It's painfully slow. That's just the reality.
Thanks for your question, Mary Rose. I similar to Lisa, just in my experience of some of the impacts that affect the execution from a structural perspective, like Lisa mentioned, there's a lack of core or sustainable funding often, which can either lead to very ad hoc engagement or unfortunately, maybe unintentionally, tokenistic engagement in this sort of work. So there really should be, and I hope in the future, more dedicated budgets for these things to support honoraria accessibility, childcare, transportation, etc. Sometimes, like institutional rhythms and deadlines, like the pace is not always aligned with the community in which we're working with. So sometimes the structural rigidity leaves little room for like an iterative engagement process. And there could be barriers to entry because of, if there's a lack of budget or agreement in place, like we kind of talked about earlier in terms of ASL, LSQ interpretation, if the spaces in person aren't sensory friendly, or the physical, if there's no physical accessibility supports available and the funding for that. So that can also pose a bit of a challenge. Just also norms around professionalism and academic language may exclude some community knowledge systems, because often these institutions are trying to, they operate in like a neutral system, which is grounded in like settler colonialism and able-bodied middle-class norms. So that would need to be very deliberately restructured and discussed in order to kind of at least acknowledge the power dynamic there. So those are the few things I see as like the structural barriers in place. So
Thanks.
thanks.
Good to see you. You look wonderful.
You too. Thank you.
Can I just add one other question? And it's more related sort of to point one of what you talked about, Lisa, which is kind of the grant process, if we just look at it as one big thing. And obviously, there are problems with that because you don't have budget until you get the grant. And yet, if you're going to write the grant with input from people with lived experience, then you need some kind of a budget. So it seems to me, and like I said, I've worked in these environments, not in mental health, but in other areas. And normally there's like an overhead department of some kind. So what that would mean is the institution would pick up the costs for defining the grant. And I'm not going to ask you if there's any hope of that or anything, but I just kind of wanted to point out that sometimes the structure itself has to somehow change.
Yeah, it's a real problem. We want to do engagement as early as possible, but we can't do engagement if there's no money to do engagement. So folks are working around this by using the end of one grant to fund the startup of another grant. They're just coming with creative solutions. And there's a little bit of CAMH funding to help with that. We have a lived experience research committee of which Mary Rose is a member, and the researchers can come and bring their grants to that for a one-off consult. It's not long-term sustained consultations, but it's a one-off consult that gets them a little bit of lived experience voice in it. And we can support small amounts of engagements before the grant, but there's a limit to how much money there is in an institution to do that. So I would like to see more pre-grant mini grants, just a call for mini grants for a couple $1,000s to do a handful of engagement sessions with folks to help develop their grant applications. That's a future state.
I think that's a wonderful question, Mary, that you raise. And I know at the Leong Center, this is a concern that our members have also raised, is how do you fund those initial pre-engagement pieces that are so incredibly important to laying the foundation to what comes next, which is exactly what we're discussing. And in the existing landscape, there's of course some funding opportunities that exist, but highly competitive. And I'm proud to say that the center this year ran its first cycle of an exact grant of what you're describing to help support the work of our members. And I'm looking forward to seeing it continue to run in the future to support initiatives just as you're describing. I did notice that we had two questions come in the chat, so I just want to raise those as we kind of near the end of our session together. The first question is, earlier in the presentation, Lisa, you had discussed who counts as someone with lived experience. If someone has a PhD or MD with lived experience, do they count? I think this is such a unique question. And how do we assess eligibility and how do we include those with differing education levels?
I wish I knew. I haven't figured that one out yet. And that's the topic of one of our qualitative studies that's under peer review right now. We want to be able to pull those things apart because I've been conflicted in that situation before. I wrote a paper with a family member partner who had a PhD in a different field. And it was fascinating because he had really good, important contributions to make from his field, from his lived experience, but also from his field. And I've been involved with some PPI, patient and public engagement, on the public engagement side in the UK, where one of our public people was actually a junior faculty member looking for engagement for research opportunities. And her feedback was mostly around my reference style. And that didn't feel right. That wasn't true engagement when you're criticizing my reference style. So I'm not sure. Certainly their lived experience is valid. If you have an MD and lived experience, your lived experience is absolutely valid. But what is the experience you're bringing to the table on this project? Claudia, help me out on this one.
Yeah, it's tricky. I wish I had the answers. Thanks, Vicky, for your question. Yeah, I don't know. All I know is that in these spaces, I feel like positionality really matters. And so being able to articulate, especially someone who may be in a more privileged educational background. So that really can shape how their lived experience is perceived and received. So just being sure that there are safeguards in place to talk about those with a more professionalized voice and ensuring that they're not speaking over or replacing those with less institutional power, I think is really important. But again, like who counts as lived experience experts? I think as long as their experience is grounded in like the personal, and that's shaping their professional role perhaps. I mean, it's valid. It's just it is a little tricky there. So there's no perfect checklist. I think it's all about just ensuring that we're not replacing or speaking over those who may be in a less privileged circumstance. So I don't know if that answers your question, Victoria, but yeah.
It's a great question, and thank you both for your response. And I am looking forward to that publication when the time comes. We have one final question in the chat before we kind of wind things down for our session. When you engage youth and caregivers separately, how do you deal with conflict between groups? Example, different recommendations on project next steps, analysis, etc.
Yeah, that's another good question. Coming to some kind of consensus can be difficult, especially when the folks are not in the same room together. I think it depends to a degree on what is the research about. If the research is about youth experiences, then youth experiences come first. If the research is about caregiver experiences, then caregiver experiences come first. So we need to allow each group to find their niche. I know we often have caregivers unhappy that their experience is second place when it's youth-oriented research. So it's really hard to navigate, making sure you find ways to include their voices, but in ways that are also acceptable to the youth when it's a youth-focused research study. Not easy.
No, that's certainly a great question, but I like your approach in terms of how to at least start distinguishing that and how you could potentially approach it with some openness and conversation. That brings us to the end of the session, actually. So, again, I want to thank our speakers for sharing their engagement work with us and to everyone who joined today's Community Engagement Series event. This is our final session before we take a summer break. We will be announcing the next series of events in our September Leong Center newsletter. So if you are not a member, I encourage you to become one so that you can receive that newsletter when the time comes. For everyone else, have yourselves a wonderful rest of the day, a great long weekend, and I certainly look forward to seeing you all in the fall. Bye now.